I'm the vision assessment student that's going to be performing your exam today. So the purpose of this exam is to evaluate your neurological system. Before we get started, you can take your shirt, shoes, and socks off for proper visualization. I'm going to wash my hands in the meantime. Perfect. Alright, and then I will also perform a mental health evaluation at this time. So to get started, I'm going to evaluate nasal patency. So I'm going to have you include one of your nostrils and take a deep breath in. Perfect. And then go ahead and do the same on the other side. Perfect. Alright, and then to test cranial nerve 1, olfactory, we're going to be assessing her olfactory nerve with 2 distinct scents. So I'm going to have you close your eyes for me and include one nostril, and then continue to breathe normally, and let me know what scent you smell. Copy. Alright, and then go ahead and close the other nostril. Continue to breathe normally. Alright. And then moving on to cranial nerve 2, which is optic, we will be assessing your neurovisual acuity using the Rosenbaum chart. So I'm going to have you hold this at arm's distance, include one of your eyes, and read the smallest line possible. 5, 6, 3, 2, 9, 7. Perfect. Go ahead and do the same with the other hand, other eye. 5, 6, 3, 2, 9, 7. Perfect. And then do the same with both eyes. 6, 6, 3, 2, 7, 9. Perfect. And then I would also test her distant visual acuity using the Snellen chart at about 20 feet away. And I would perform this with and without corrective lenses. And then I will also be assessing peripheral vision with the peripheral vision through gross confrontation. So I'm going to have you hold your hands at heart center and lift your fingers up when you see mine come into your peripheral vision. Perfect. Alright, and then for cranial nerves 2 and 3, 3 being oculomotor, we'll be assessing pupillary constriction, direct and consensual. So I'm going to place my hand on your nose here, and direct, consensual, and the other side, direct and consensual. Perfect. And then also be assessing pupillary reaction through accommodation, cranial nerves 2 and 3 as well. So whenever you shift your focus to the wall behind me, and whenever you see my pen light come into your field of view, switch your focus there. Perfect. And then for cranial nerves 3 and 4, 4 being trochlear, we're going to be assessing direct pupillary reaction to convergence. So go ahead and follow my pen light into your field of vision. Perfect. Alright, and then we'll be assessing extraocular eye movements for cranial nerves 3, 4, and 6. 6 is abducens. So go ahead and focus your vision on my tip of my pen light and follow it out without moving your head. And stopping at the 6 cardinal points, looking for nystagmus. Alright, and now for the fundoscopic portion of the exam. So I'm going to go ahead and dim the lights and ensure that the diopter is on 0. Perfect, and then I will have my finger on the diopter. I'm going to assess for the corneal light reflex from about 4 feet away. Perfect, and then I'm going to move in close to the patient at 15 inches away, 15 degrees lateral. And I will be assessing for the presence of the red reflex. At that point, I will advance toward the patient, checking the optic disc and margins, cup to disc ratio, retina, the arteries and veins, and the condition of the retina. And then once I find the red reflex, I'm going to move towards you, and I'll be asking you to look into the light. And at that point, I'll be assessing the fovea and macula. Move towards me. Do the same on the other side. Move towards me. Alright. And that completes that portion. So now we will go ahead and be assessing. At this point, I would perform the corneal blink reflex using a cotton ball and swiping it across the cornea, testing cranial nerves 5, trigeminal, and 7 facial. And then I'm going to go ahead and test cranial nerve 5. I'm going to have you clench your teeth, and then I'm going to palpate your temporalis and masseter muscles. Perfect. And then I'm going to test your sensation along the 3 branches of the trigeminal nerve. So I'm going to have you close your eyes and let me know if the sensation feels the same on both sides. Does this feel the same as this?
Mm-hmm.
That was ophthalmic. Does this feel the same as this?
Mm-hmm.
Axillary. Does this feel the same as this?
Mm-hmm.
Mandibular. Alright, and then moving on to cranial nerve 7, facial. I'm going to have you close your eyes and try to resist me opening them. Perfect. Alright, and then also for cranial nerve 7, we'll be evaluating facial expressions. I'm going to have you raise your eyebrows, frown, smile your teeth, show your teeth, and then smile, and then puff out your cheeks, and then pucker your lips and try to whistle. Perfect. Alright, and then cranial nerve 8 is vestibulocochlear. I'm going to be assessing your hearing through the whisper test. So I'm going to include one of your ears, and I'm going to whisper a 2-syllable word. Go ahead and repeat back to me.
Roundup. Jelly bean.
Perfect. Alright, and then for, at this point, for cranial nerves 9, which is glossopharyngeal, and 10, vagus, I would perform a gag reflex using the tongue depressor, pressing posterior pharynx bilaterally. And then for cranial nerves 9, 10, and 12, which is hypoglossal, I will have you stick out your tongue for me and say ah. And at this point, I am going to use my pen light, and I will be evaluating the rise of the soft palate and the quality of the patient's voice and speech. And then for cranial nerve 11, I'm going to be assessing your muscle strength of the trapezius and SCM. So when you feel my hands, just try to push against them. Perfect. And then pushing my hand here. Pushing my hand here. Perfect. Alright, and then for cranial nerve 12, I am going to have you stick your tongue into your cheek and try to resist my hand. Perfect. And I'm evaluating the position, symmetry, and strength, as well as the right to left movement of the tongue. And then also for cranial nerve 12, we'll be assessing the lingual speech. So I'm going to have you repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Perfect. All right. So that concludes that portion. Now we'll be assessing motor and muscle strength. So I'm assessing the upper and lower extremities for muscle bulk as well as atrophy, and then I'll also assess them for muscle tone. Upper and lower extremities, perfect. All right, and then for the following movements, I'm just gonna have you press against my hands when you feel them on to me. So C5, C6, shoulder abduction, C6, shoulder adduction, and then C5, C6, wrist, elbow extension, flexion, elbow flexion, C6, C7, C8, elbow extension, C6, C7, wrist flexion, C6, 7, 8, wrist extension, and then I'm going to have you grip onto my fingers, C7, 8, T1, and then go ahead and hold out your hands like this, and then this is finger abduction with C8, T1, median nerve, ulnar nerve, sorry, and then go like this, and try to, don't let me break your fingers, this is no opposition, this is C8, T1, and median nerve. Alright, moving to lower extremities, we have hip flexion, so this is L2, L3, L4, and then hip adduction, L2, L3, L4, hip adduction, L4, L5, S1, hip extension, L5, S1, knee extension, L2, L3, L4, knee flexion, L4, L5, S1, S2, and then ankle dorsiflexion, L4, L5, and then plantar flexion, S1, and then big toe extension, L5. All right, and then I will also be assessing ankle clonus at this time. your eyes for me and resist and just relax for me. Perfect. Alright. Okay, and now I'm going to be assessing light touch sensation.
What is on?
Okay.
I think it's light touch.
So now we'll be assessing light touch sensation along the upper and lower extremities. So just go ahead and close your eyes and place your hands out like this, palms up, and let me know if the sensation feels the same bilaterally. So C5, this feels the same as this. C6, this feels the same as this. C7, this feels the same as this. Sorry, C7, C8, does this feel the same as this? G1, does this feel the same as this? G4, does this feel the same as this? I would do this underneath clothing, and then have you lay down for me. And then T10, does this feel the same as this? And then inguinal, does this feel the same as this? Perfect. And go ahead and sit back up. And then L4, does this 3? Oh, does this feel the same as this? L4, does this feel the same as this? L5, does this feel the same as this? And then L6, does this sorry, S1, does this feel the same as this? Yes. Great. Perfect. Alright, and then now I'm going to be assessing your positional and vibrational senses in the upper and lower extremity using the index finger and the big toe respectively. I'm going to have you close your eyes, and I'm going to move your finger around and let me know if you feel the position up or down. Up. Down. Great. Alright, and then we'll be assessing vibrational sense in the upper and lower extremities. So I'm gonna place this on your index finger and let me know if you feel pressure or vibration. Go ahead and close your eyes for me.
Vibration. Vibration.
Alright, and then we'll be assessing stereognosia. So I'm gonna place 2 different objects in the palm of your hands, and I'm gonna have you let me know what you think the objects are.
Paperclip.
Perfect.
Cotton ball.
Alright, and then we will be assessing graphesthesia. So I'm going to have you keep your eyes closed, and I'm going to write 2 different numbers in the palm of your hands, and let me know what you think they are.
1.
Perfect. Alright, and then now we will be assessing reflexes. So first we're going to start with the biceps reflex. This is C5 and C6. Have you relax for me. We'll do it on the other arm. Perfect. Alright, and then next is brachioradialis reflex. So this is also C5 and C6. Opposite arm. Okay. And then the triceps reflex, C6, C7. Just go ahead and relax your arm for me. Perfect. The other arm. Perfect. Alright, and then moving to the umbilicus, and then we lie down again for me. And above the umbilicus is T8, 9,
My bad.
T8, 9, and 10. Testing the abdominal reflex. And then below is T10, 11, and 12. Perfect. And, oh yes, yes. Alright, next, patella reflex. This is L2, L3, L4. A little bit more down. You can't see me. So here. Like my patella, that could be. Oh, there we go. Okay. Alright, and then Achilles is L5S1. And then lastly, plantar reflex is is S1. Perfect. Alright, and then lastly, we will be assessing coordination. So I'm going to have you touch your finger to your nose and then back to my finger 3 times. And then close your eyes. Perfect. Alright, and then we're going to assess, I'm going to have you bring your, the bottom of your foot up your shin. Both sides, perfect. And then we'll do rapid alternating movements, so go ahead and switch the light bulb. And then touch your finger to your tongue. Perfect, and then go ahead and tap my feet. Perfect, tap your feet to my hands. Alright, and then I'm going to have you stand up for me. And I'm going to have you put your feet together, eyes closed. And I'm assessing Bromberg drift. And then I'm going to have you put your arms out towards me, elbows or hands up. Perfect, and I'm assessing pronator drift. And then I'm also going to be assessing your movement in the upper extremities. Perfect, and blink, open your eyes for me. And then I'm just going to be assessing your gait, so I'm going to have you walk normally forward. Turn around, you can walk heel to toe. Perfect, and then walk on your toes. Walk on your heels. And then jump on one leg. Jump on the other leg. Jump on both legs. Perfect, and that